Hi, I'm Trevor Schell,
And I'm Andre Gauvin.
and we're ergonomists with the Occupational Health Clinics for Ontario workers.
We're here today to show you some tips on how to shovel safely.
Do you often feel overwhelmed with all the snow we get each year? Tired of being sore after shoveling? Do you want to learn about snow shoveling safety and efficiently? Well, today we're going to talk to provide you with a few pointers on ergonomics and shoveling. As Canadians, we're accustomed to shoveling snow. For many of us, we shovel to get out of the driveway or to keep our driveway clean and safe for pedestrians. But for others, it's a job requirement that requires them to shovel for a good portion of their day, if not all day. But how many of us think about buying an appropriate shovel, or the effects of shoveling techniques and reducing the risk of injury? Just because you shovel snow doesn't mean you're going to have a heart attack. There's actually some good news and bad news when it comes to shoveling snow. 15 minutes of shoveling is considered moderate activity, and it's a good way to keep in shape and burn extra calories. The bad news is that there has been an increase in both fatal and non-fatal heart attacks in recent years due to an aging population. This is due to people continuously overexerting themselves and becoming injured.
Many people should think twice before shoveling. Elderly people, anyone who has had previous heart attacks, people with a history of heart disease, high cholesterol, high blood pressure, smokers, people leading a sedentary lifestyle, people with existing back problems. Anyone mentioned above should consult a physician prior to shoveling snow. I'm sure you're saying, well, why don't I buy a snowblower? You do not necessarily have to run out and buy a snowblower. Not everyone who shovels snow is going to have a heart attack or get injured. Snow shoveling can be good exercise when performed correctly and with safety in mind. Prior to shoveling snow, it is important to avoid stimulants such as caffeine and nicotine. Stimulants can place extra stress on the heart, increasing the heart rate and causing blood vessels to constrict. Avoid eating large meals as this places extra demand on the digestive system, which may result in stomach cramps. And drink plenty of water. Dehydration is as much of a problem in the winter as it is in the summer.
Be sure to dress warmly. The nose, ears, hands, and feet need extra attention in cold weather. Wear a turtleneck, sweater, toque, scarf, face protection, wool socks, and waterproof boots. Place the scarf or other face protection over the nose and mouth to avoid breathing cold air. Dress in layers so you can remove a layer as needed. Wear proper footwear. Boots with slip-resistant soles can help to minimize the risk of slips and falls. Warm up for 5 to 10 minutes to get the joints moving and increase blood circulation. Aerobic activities such as marching on the spot, climbing stairs, or even going for a quick walk around the block will help. For stretching, gently stretch the back, arms, shoulders, and legs. Be wary of your back. It is very vulnerable when you first wake up. Back muscles will stiffen while you sleep. Avoid exerting yourself shortly after getting out of bed.
Use a lightweight, non-stick, push-style shovel with a maximum weight of about 1.5 kilograms or about 3 pounds. Shovels with a bend in them, as opposed to the straight broomstick style, are better for your lower back as you adopt a more comfortable stance, and the contoured handle allows you to reduce forward bending. These have been called ergonomic by many manufacturers. However, to truly be ergonomic, the length of the handle should be adjustable to accommodate different heights instead of the one-size-fits-all design. Ideally, the handle should come up to one's chest height in order to reduce forward bending that may stress the lower back muscles. A larger shovel will allow you to scoop larger amounts of snow. However, a smaller shovel will allow you to scoop less. By scooping less snow at a time, the risk of getting injured is decreased. Large blade shovels should be used to push the snow, and small blade shovels should be used to lift and throw the snow. Use a shovel with a smaller blade for throwing snow. About 10 to 14 inches is ideal. Try to avoid shovels with a metal edge when shoveling sidewalks or cracked surfaces, as the metal edge tends to get caught. And feel free to spray your shovel with Teflon or cooking oil to prevent the snow from sticking. What is the recommended shoveling rate? The Canadian Centre for Occupational Health and Safety recommends a rate of 15 scoops per minute. Shoveling should not last longer than 15 minutes, followed by a 2 to 3 minute break. The recommended weight to be lifted depends on shoveling rate. For example, a high rate of shoveling, about 15 scoops per minute, the total weight per shovel should not exceed 5 to 7 kilograms, or about 10 to 15 pounds. For a lower rate of shoveling, the maximum should be around 11 kilograms, or approximately 24 pounds. Remember that weight limits are only a guide and should be reduced based on your physical fitness level. In this example, the person is using an ergonomic shovel to push and throw the snow. Notice that when throwing the snow, the person can bend their legs and have a proper posture of the back while throwing the snow. In this example, the person is pushing and throwing the snow with a regular shovel. The weight of snow drastically changes as the density of snow increases. Light, dry snow will weigh around 3 pounds per cubic feet, where wet, heavy snow will weigh about 21 pounds per cubic feet. If an individual were to clear a 16-foot by 30-foot driveway covered in 1 foot of wet snow, they would be moving approximately 4 tons of snow.
Throwing height should not exceed 1.3 meters or approximately 4 feet. The optimal throwing distance should be no further than 1 meter or 3 feet. And the load in the shoveling rate should be reduced if the task requires a longer and/or higher throw. In this example, not only is the person throwing too high and too far away from them, they also don't have a stable base of support. You notice at times they're only standing on one leg, which could lead to a slip or trip hazard. In this example, not only is the person standing with both feet firmly on the ground, they're also trying to get themselves as close to the snowbank as possible before throwing the load to minimize strain on the lower back.
Ergonomic designs of shovels have been created to try to reduce the risk of injury to the lower back. One of those ergonomic designs is called a wovel. In this example, the person is using the wovel to push the snow. Notice how the person can avoid bending and keep their back straight while pushing the snow. In this example, the person pushes and throws the snow using the wovel. As you've seen in the previous video, throwing the snow using the wovel can be difficult. In this example, the person pushes the snow with the wovel and throws the snow using an appropriate shovel. There are many tools designed to remove snow. Regular snow shovels, ergonomic snow shovels, snow scoops, ice choppers, roof rakes, ice cleats. However, it's important to choose the proper tool for the task that you are trying to complete.
It's important to watch for signs of a heart attack. Many people die from heart attacks because they do not seek medical attention quickly enough. Be familiar with the signs and symptoms of a heart attack. If you experience any of the following, stop shoveling and contact your physician immediately or contact 911. Symptoms include shortness of breath and difficulty breathing, nausea, sweating, for example, cool or clammy skin, sudden pain or discomfort that does not go away with rest. The pain may feel like a burning, squeezing, heaviness, tightness, or pressure. The pain may be in the chest, neck, jaw, shoulder, arms, or back. You could have a tingling or pain or numbness in the left arm. Chest pain or discomfort that is brought on with exertion and goes away with rest. And in women, the pain may be more vague. Some helpful hints include clear the snow early and often. During a large snowfall, shovel frequently. Do not wait for all the snow to fall before shoveling. Fresh snow is fluffy, light, and easier to move than heavily packed or wet snow. Pace yourself. Start out slowly and take breaks often. Do not rush to clear all the snow at once. Try pushing and lifting during large snowfalls in small layers. For example, shovel an inch or two, rest, and then repeat.
If you must lift snow, fill your shovel no more than half full. Avoid using your back to lift, bend your knees, keep the back straight, and lift with your legs. Scoop small amounts and walk to where you want to dump it. Avoid awkward throwing postures. Do not throw snow over your shoulder or to the side. If you need to move the snow to one side, reposition your feet to face the direction the snow will be moved. When removing snow, look out for ice patches and uneven surfaces under the snow or on the ground that can cause you to slip and fall. Take smaller steps in icy conditions, and wear boots that have a slip-resistant sole. Anti-slipping cleats or footwear could be used by those who are prone to falling. Ask for help. Ask someone to help you if you feel shoveling is a huge job. And remember to listen to your body. If you feel tightness or pain in your chest, stop right away and call your doctor. If you become sore after shoveling, seek appropriate medical advice.
See what you're shoveling. Do not let a hat or scarf block your vision, and make sure your glasses are not foggy. Think ahead of time. Try to throw your snow far early in the winter. Avoid pushing all your snow to the end of the driveway. Make a path down the middle of the driveway and push all the snow to the sides. And keep the snowbanks the same height all the way down the driveway. Try and shovel the snow as soon as you see the snowplow pass. The sooner you shovel the slush, snow, and ice from the snowplow, it is easier to move. If you wait, the pile of snow will turn to hard packed ice and will be harder to move. This snow is heavy, so lift half-filled shovels and walk to where you want to place it. Do not throw it. Use caution when using a snowblower to avoid muscular strain. Keep the blower close to the body. For example, stay between the handles. When there is a large amount of snow, do not take full passes of snow. Instead, take half passes. Let the snowblower drive itself. That is why we have them. To help us, let it do the work. Vibration. Avoid prolonged periods of snowblowing. Share the job with rotation or break it up. Gripping depends on the controls. Some models have a drivetrain that only run when the lever is pressed. This can be hard on the wrists. Take breaks or share the job.
Avoid lifting the snowblower by yourself. Watch for changes in elevation or features that stick out. And earplugs are always recommended when using a snowblower. On an important note, a study in Detroit identified 43 heart attacks after a series of snowstorms. These heart attacks were all attributed to physical exertion, and 36 occurred while removing snow. Several of these heart attacks occurred while using a snowblower. This helps to illustrate that while removing snow can lead to a heart attack, using a snowblower does not eliminate the possibility of suffering a similar fate while removing snow. Make sure that you warm up first. Take your time, especially after the first big snowfall. Have the proper tools, dress properly, take frequent breaks, stay hydrated, and know when to stop. By planning ahead of time and being prepared for all possible conditions, snow removal can be a great exercise.